I'm Ashton Addison from EventChain for Investment Pitch Media and FinTech News Network. And today on Blockchain Interviews, we have Sunny Ahonsi, the CEO of Medi-Lives. Sunny, thank you so much for taking the time to be on the show. It's a pleasure to have you here today.
Thank you. Thank you for having me.
You're very welcome. I'd love to kick off our interview with a little bit of background on your expertise in the healthcare and as well how you got into the blockchain industry.
Okay, well, very, very interesting. My background originally is I work as an accountant professionally. That's what I qualified to be. But over many years, I have worked with a lot of healthcare organizations in the UK. And I became an assessor on health and public health in the UK. And I lecture in various colleges and institutions, and as an assessor in terms of healthcare and healthcare dispensation for many, many years. But against the background of why MediLives was actually established was my experience I had about 8 years ago with my son. Now, every successful business, whether it's Facebook, whether it's McDonald's or Kentucky Fried Chicken, Amazon, Alibaba, there's always a story behind their genesis, the genealogy. My story in terms of healthcare infusion with technology was actually my experience with my son when I took him to accident and emergency in England around about 11 p.m. in the night. You could not have access to your private doctor. You had to go to hospital. And we were in the hospital for about 11 hours. And that was a long time. Mm-hmm. Only for the doctor to come along and test him just for under 50 seconds. Wow. And that was it. Then I said, the little man could have died. Anything else could have happened to him. The situation could have been worsened. There got to be something that can be done, whereby that diagnosis could have been done in the comfort of my own home and seeking immediate and speedy remedy for his situation. Mm-hmm. So I started thinking. I started phoning around a lot of my contacts, my medical team, and some of them said, no, it cannot be done. You will not imagine. I went through around about 20 to 30 doctors before I could find one or two to say, yes, I think it can be done. Then I got a hold of my blockchain partner, people like Garrett's and all the rest of them. So we're putting things together. Over the last 2.5 years, we came up with MediLives, an AI-based on a blockchain telemedicine technology that has the capacity and the capability to be able, people can diagnose themselves in the comfort of their own home without the need for them to go to a physical location to go and see a doctor. And they can receive a feedback almost instantaneously. So for the doctor, it reduces the stress. The doctor can work in his home, taking data and the analysis of the patient in the comfort of his home, in the bedroom, in the kitchen, without the need for him to go to a physical clinic to actually do all of that. And the patient can receive medical attention regardless of the geography he or she is in any location, 7/24/365. That is the whole idea. So I would say we are really the medical Uber in a sense.
That's amazing, Sunny. So you've created MediLives to solve this and use telemedicine to, get responses from doctors faster. Can you tell us a little bit about when you started it? How far along have you gotten now, and is the product in the market?
Okay, the project overall started about 2015 when I started gathering all the different doctors and IT specialization. That was when I actually got into the blockchain in food. So I began, what actually attracted me was the fintech, infusion of finance into technology. Then I said, there has to be meditech. That's where the word medicine actually came along. Meditech simply represents medicine infused with technology. Mm-hmm. Yeah. So it's the infusion of both. How I can apply technology into the medical world in order to enhance performance, in order to reduce costs. So that was against all that background. I really wanted to come up with something very innovative and very different. Now, the technology in terms of telemedicine or AI in medicine, they already been around, but they have not been put together the same way that I have done it.
Mm-hmm.
What we've done, I mean, you may have Apple Watch or whatever it is, all the diagnosis or monitoring devices. The limitation they have at the moment is they can be done and the information remain with the patient without giving in to the doctor.
Mm-hmm.
What we've done, we've gone beyond that, that yes, it is good for you to record this information. The information recorded, and that information is stored on the server, on cloud, and that information is made available to your medical doctor in an instant. Your medical doctor with a video conferencing call has the ability to be able to take your data and say to you, asking, you know what, yes, we just received your data. I think your temperature is too high or your diabetes level is improved. Would you like to come and see me in the clinic? Or you're okay, these are the prescriptions, this is what you need to do, job done. That's the whole idea. Reducing all that time taking, reducing all that cost taking between the interface of the doctors and the patient at the same time. And also, the app has the ability to be able to locate doctors in any part of the world, pharmacists in any part of the world, in any geography you're in,
Mm-hmm.
be able to pinpoint exactly the location you're in at that point in time, and remedial action can be taken. If your doctor, let's say I'm based in, I've gone to Canada, or I've gone to Addis Ababa, I've gone to any part of the world, my doctor in the UK has the ability to know where I am at any point in time because it works with GPS. Yeah. And that information about my health can be sent to my doctor, and my doctor can monitor and do that and report back to me. And that same information can be sent to my next of kin, who will be aware exactly what is actually happening to me at that point in time and the geography where I am. If I cannot have access to my doctor in the UK, guess what? The system has the ability to locate a local doctor or hospital whereby I can receive medical dispensation.
Mm-hmm.
This is all, that's why it's innovative and totally different from the contemporary devices that's available at the moment.
That's great. And is the application live in the markets right now and treating people?
Okay, the application will be live in the market from November the 15th.
Okay.
But the initial deployment internally, we are targeting for the 14th of September this year. Marketing, full-scale marketing is anticipated to be in the first quarter of 2020. So 2020 will be the full market scalability of the application.
Mm-hmm. Great. And can we speak a little bit about how this affects the revenue model traditionally of doctors going to the clinic versus now doing it on an app? How does the revenue model work for the doctors are paid the same, and how does MediLives profit from that?
Okay. Now, let's start with the revenue model. The revenue model is very, very simple. The app will be available for download free of charge.
Okay.
And patient or new entrant has the ability to use it for tests for a period of 30 days. After that, then to use the app to check your ECG, your stress level, your diabetes. So there are about 20 different irregularities that the app has the capability to detect and monitor. Now, what that happens is this. The patient, for using the app, pays around about, this is just a hypothetical fee, around $20 or £20. Let me use £20. £20 is stronger than £20, $20. Now, that information is recorded on the blockchain. That information also is made available to your doctor, who can be able to give you a feedback within 24 hours rather than wait, or far less than that. If it's unable to get connected to your doctor, then it can move on to the next doctor that have been approved on our network within that capability.
Okay, great.
Now, the whole idea of all of that is this. When a doctor comes on board, the doctor we will verify the doctor. You say, okay, Aston, you say, look, I'm a medical doctor based in, Vancouver. We said, okay, fine. Send us your detail, your CV, your 2 references, and your medical ID within the, Canadian Medical Association. We are able to access your detail, of course, with your consent. And once all that information is collected, collated, detail verified, then we'll upload it onto the system. We're going to have different specializations: general medicine, pediatrician, cardiologist. All the different specializations will be on the app. So you can have access to any different doctor at any point in time, not just a general medical dispensation. Now, this is the deal. This is where the economic model is. The doctor will select or accept the patient. The doctor will say, okay, to the patient, this is going to be the cost, or what is going to cost you for you to be treated. The patient will then pay, because the app will have internal system whereby patient can pay for their medical bill. And one of the payment system is using the MediLives token. So this is the first token. This is the first coin that has a system built in within itself to pay for the goods and services within the ecosystem itself. This is the only one. As far as I understand at the moment, looking into all the 2,449 cryptocurrencies out, MediLives token is the only one that has the ability for you to use it to make payment for services for the medical system that we created. Now, the doctor is accepted on board. Once the doctor becomes available, it becomes one of our doctors in our network. The doctor charges the patient pays through the payment system within the app, the MediLives app. Automatically, the doctor will be paid. Let's say we agree 80% to the doctors and 20% to MediLives for creating that platform. It's as simple as that. So the business model suggests that MediLives earns money in 2 different ways. One, for people using the app diagnostically, and the second one is actually bringing the patient to the doctor, and the doctors will pay MediLives for actually providing them with patients that they would not have had in the normal way of business. Bear in mind that the doctor could be based in America, in England, in Ethiopia, and deal with a patient based in any location in any part of the world. So the doctor, they do not have the need or a compelling reason for them to go to a clinic or a hospital in a physical location. They can actually work in their own home, deal with those emergencies as they arise in the comfort of their own home. So the doctor's income is increased, and the traveling time and the cost of actually carrying out his own duty have reduced in terms of travel and in terms of every other inconveniences. This is the whole idea. So 7/24/365, patient will have access to doctors, and doctor will have access to the patient, and businesses immediately they wake up from their bed or before they go to bed to sleep.
That's great, Sonny. And are you guys expanding currently? Are you looking for strategic partners, expanding the team, or just looking for more investors?
Okay. Now, we are actually we're looking for investors, yes, to move the product forward. But you got to appreciate at this point in time, we're not desperate for investors, because we've already developed the app, we already developed the technology. Some of the investors that we have at the moment is simply to move the marketing forward, to create a greater level of awareness and so forth. Yes, if a lot of investors want to be part of this, because we will give them, we hope that we'll be able to provide them with substantial ROI on their investment. Obviously, this is not, just put on a disclaimer here. We're not guarantee or promising anything in that sense. So it comes with a normal risk inherent with any business. But based on the disruptive nature and the unique, innovative nature of MediLives technology, we are confident that there is a huge market that will accommodate and will bring in a lot of economic benefit. And also, more importantly, what our objective really is to disrupt the medical environment at the moment, whereby we lessen the stress that is placed on our medical team globally.
Yeah, it's definitely a huge problem to solve. And if people are looking to learn more about MediLives or get involved with the project, what's the best way to learn more information?
Well, they can contact me, and my email is simply sunny@medilive.io, or they can just go onto the website medilives.io. So it's a very, very simple, or just Google it. I mean, if you Google it right now, it's actually on the top of Google right away. That's how popular. In fact, we haven't done any marketing yet. Our marketing activity will start from next week. So game on.
Amazing. Thank you so much for your time, Sunny. It's been a pleasure speaking to you about MediLives. All the best moving forward, and let's follow up in the near future.
Fantastic. All right, Sin. Thank you for having me. And you have a good afternoon, actually, in Canada, isn't it?